you canvassed the evidence and came to the conclusion that the weight of the evidence doesn't support this lactate anxiety hypothesis. And there's only about, I think, one in 100 on average people who experienced a panic attack whilst exercising, which, like you said, is not necessarily attributed to exercise, could be happening anyway.
Yeah, and after that, well, I did a small study where we measured anxiety in panic patients after submaximal and maximal exercise, and their anxiety actually went down. And then there's other researchers who've done, who've taken interesting approaches about this, where in one case you can give um, cholecystokinin. They infuse that chemical, cholecystokinin, or it's abbreviated CCK, and that produces some anxiety. And so if they have people exercise or not exercise before getting the CCK infusion, those who do the exercise, they have less anxiety symptoms in response to the CCK. So that argues that the exercise actually helps people cope with the an anxiety provoking stimulus. And there's another study of that type where they gave CO2. I don't know if you've are familiar with CO2 inhalation as a way to provoke anxiety in a laboratory. They've done those kind of experiments. But if you do exercise before you get that CO2 uh, exposure, then too you have fewer anxiety symptoms in response to that CO2. So really, I think useful strands of evidence to support the idea that exercise not only is not causing anxiety, attacks for prone people, but actually it's probably help attenuating their risk of an anxiety attack.
Mm. It's really interesting to read through some of the hypothesized mechanisms as to why exercise, particularly high intensity exercise, may have an anxiolytic effect in individuals, particularly with anxiety disorders. One of the hypothesized mechanisms is this idea of anxiety interpretation. If you're used to having those kind of symptoms, you interpret them in a more benign way. Because there's this overlap right between the physical symptoms or somatic symptoms of anxiety and what you get in exercise: shortness of breath, increased heart rate.
I think sometimes it falls into kind of the that people will call interoceptive exposure or fear conditioning. And so, yeah, when people have anxiety attacks, panic attacks, there's a real somatic symptom response. I'd say it's often idiosyncratic. So some people might sweat heavily. Other people might have a very strong increase in their heart rate. Others might be hyperventilating, and but not everybody gets all those, with their flavor of anxiety attack. But anyway, it's noticed 60s and 70s that well, that sounds a little bit like what happens when you exercise. I'm sweating, I'm breathing harder, my heart rate's up. And so, well, that's interesting. And then they said maybe we can use that as a way to help people unlearn the fear conditioning and realize that they can have these symptoms and still be safe. So there was some psychiatrists that initially tried to do that, like right in the office, and sometimes they just have a step stool and just step up, ask the patient to step up 10 or 20 times. Other times they would just have them in the chair and spin them around. So to make them feel a little dizzy, because that's, with hyperventilation, that's one of the symptoms. So, they depended upon the practitioner, they might take different approaches as well as the client. What's their main issue? And and since that, so those showed some pretty reasonable results with case studies, and now there's been some other, more detailed work with larger samples. There was even a guy at NIH, I forget now his name, but he was doing some of this, and I think the evidence is, there's not large randomized controlled trials that I'm aware of that test that, but it does make sense that if somebody can regularly be exposed to these symptoms through exercise, that and then they don't have a panic attack, everything is safe, they can start to learn that maybe if I have those symptoms, it doesn't always lead to a panic attack. Because as you know, there's often a positive um, cycle in response to the symptoms. So I can feel my heart beating harder, then that leads to worrying about that and make the heart respond even greater, or other symptoms kick in. And that often is the cognitive component that ends up driving panic attacks in some people. So, so I don't know also if there's good studies that would indicate how many psychiatrists and psychologists or other people who treat folks with panic disorder, how frequently that's used. I think in general, people, maybe many professionals have heard of it, um, but I've never seen good statistics on 1% or 10% are using that as a treatment modality.
Well, yeah, it's interesting you mentioned that, and you mentioned interoceptive exposure, Pat. I just finished my formal training as a provisional psychologist here in Australia, and the predominant treatment that we are taught to use for patients with panic disorder is indeed exposure therapy, and it is talked about that, much like you gave with those examples about spinning in a chair or running on the spot, exercise in a safe setting with your practitioner is a way to get people to experience those symptoms and then again have a more safe and neutral interpretation. And I think it should be said that I'm certainly not encouraging people to go out and to their gym if you have a panic disorder and jump on a treadmill and get your heart rate up to close to your max heart rate straight away. Safe environment, build it up with exposure therapy. But it's interesting to note that getting your heart rate up through exercise is indeed one of the main treatments, if you like, for exposure therapy for patients with panic disorder.